How do you spell vancomycin?
Our med presentation is over vancomycin, which also goes by the brand name Vancomycin. This medication treats infections by killing bacteria in the intestines. This med is classified as a glycopeptide antibiotic. Vancomycin is used mostly against staph and strep infections. There are some indications that are supported by the FDA and some that are not. Some examples of FDA-supported indications are endocarditis, C. diff, and skin infections. Some examples of non-FDA-supported indications include bacteremia of the IV line, febrile neutropenia, and bacterial meningitis, to name a few. Routes of administration for vancomycin include oral and IV. Vanco will be given orally if the patient has C. diff. It can be given IV piggyback and push for all other infections.
Some contraindications to remember before giving or taking vancomycin include low white blood cell count or kidney disease. Also, do not give to a patient who has taken or is taking aspirin or if they have a corn allergy, and do not give to a patient if they are pregnant or possibly pregnant. The most common major side effects include decrease in urine output of less than 30 mL per hour, increased thirst, bladder pain, an irregular heart rate, urinary tract infections, Redman syndrome, and renal failure. This medication does have a black box warning for embryo-fetal toxicity, which is why we do not give this to a patient if they could be pregnant. Redman syndrome is a common allergic reaction to vancomycin. Patients typically have signs and symptoms such as a rash on the face, neck, and upper torso following IV administration. When giving vancomycin, we need to educate our patients to take it at the same time every day. We need to let the patient know to contact their doctor if they experience any of the following symptoms: rash, difficulty breathing, wheezing, chest tightness, or blood in the urine.
Here we have listed the costs of vancomycin in oral and IV form. When a patient is taking vancomycin, we will need to do a few assessments, including skin, respiratory, and GU assessments. We will also need to assess the patient for hearing loss because vancomycin is associated with ototoxicity. As far as monitoring goes, we will do all of the assessments stated in the previous clip as well as checking a CBC because neutropenia and thrombocytopenia are common. Vancomycin is a very effective drug, but like most antibiotics, it's becoming resistant, so it's Use should be limited. In one study, 87% of patients showed a decrease in temperature, abdominal pain, and diarrhea within 48 hours.
The end! Thank you for watching.